Wow,
Okay.
nice.
Welcome everyone to this week's session of Native Strong, a weekly Native Town Hall with Dr. Lyle Gneiss from the Gerald L. Gneiss Indian Health Center. We do have a lot to go over this week, a lot going on with COVID, especially today. So just want to jump right in. For those of you who have attended before, you can enter your chat questions into the chat box in the Zoom interface. That would be at the top or bottom of your screen. Looks like a little chat bubble. If you are streaming this live via Facebook, please drop a comment in and we will get through those and moderate those as we move through the session today and answer as many as we can towards the end. With that, I will introduce you to our moderator, Mark Denning. Thank you, Mark, for being here once again.
Ruju, Nadawe Benezi Indigenous Cause, Dodem, Anishinaabe and Dao, Neopen and Donjaba. Good afternoon, everybody, and welcome to our program, a very long awaited program, certainly for the week. This chat box is going to come in very handy for those of you that want to ask questions about back to school. There's so many perspectives. The perspective certainly of the students that are being asked to go back to school, the parents certainly who have concerns of all kinds, and what's so interesting, educators and teachers themselves. And we're here and going to try and do our best to help folks understand from a medical perspective what things are about. Unfortunately, in our country, so many things have been politicized, both education and health. And we need a way to figure our way through those kinds of confusing topics. And sometimes those topics are confused on purpose. Here on Native Strong, what we're trying to do is just do a direct person-to-person conversation between Native folks and our concerns with a medical doctor. And that is Dr. Lyle Gneiss. So again, as I always share with folks in the beginning of these shows, we have the privilege to be sitting here and listening. Please be thinking about our relatives that don't have that privilege, that don't have internet, and be thinking about them. And if you may not have a question, maybe there's a question you can be asking on their behalf. So welcome everybody. Dr. Gneiss, lots to do today, so we're just gonna go right to you. And so good to see you, and let's go. COVID-19 and education.
Thank you, Mark. Thank you, Jeremiah. This is week 13, and a lot has happened even in the last week, even in the last 24 hours. So a lot of dynamic changes, and I'll be going through information that I presented before, but also introduce going back to school. So let's get started with some overarching information here from a world perspective. Next slide. Sorry about that, folks. So from a world perspective, as of last night, 16.8 million cases. This is a 12% increase from last week. 9.8 million have recovered, 15.2%, which has been pretty consistent. And the number of fatalities, 661,000, slightly up to 7.1%. In the United States, reaching 4.5, nearly 4.5 million cases here in the United States, a 12.4% increase, has been maintained pretty steady over the last several weeks. 53 million tests have been conducted up to this point. Nearly 2.2 million have recovered. Now, 86%. I know that wasn't, I double checked it, triple checked it, quadruple checked it. And I think what happened is now states are starting to report the number of recovered. So up until last week, it was like 1.1 million. And then all of a sudden, a lot of states started reporting their recovered coronavirus cases. So This is kind of the new baseline, nearly 2.2 million, and the number of fatalities 152,000, which is a 12.2% increase from the week prior. So significant increases in the number of cases there. Here in Wisconsin, this is as of last night, 51,049, 13.8% increase. This has maintained a pretty consistent level over the last several weeks. 40,416 have recovered, 35% increase since last week, and the number of fatalities is 911, 5.3% increase from the week prior. So that's been a steady progression over the last several days. Next slide. So again, just to highlight, there are 573 federally recognized American and Alaska Native tribes in the country. There are nearly 5.2 million estimated natives in the country, and 2.6 million actually utilize the federal, tribal, and urban Indian health system. 70% of the population, native population, reside off the reservation, and that's important to recognize, since I think this, as we go through the numbers, we see that as being a reflection of how numbers are being reported out. So let's get right into the numbers through the Indian Health Service. As you can see, going from left to right, the database that I use is the Indian Health Service. So these are sites that report from a federal, tribal, or urban Indian health program. And just a quick glance at the overall number of positive cases, we see Albuquerque, Great Plains, Nashville area as being pretty significant. And then we have Navajo Nation, 10,411, Oklahoma City, almost 4,500, Phoenix, 7,800, Portland area, almost 1,500 as well. And up to date, 31,431 cases in the United States. So as we go through the dates, I've been tracking this for our audience since June 11th. And now that we have several data points, we can really start looking and talking about trends that are ongoing. So as of this week, what is going on this week certainly is different from the week prior. Alaska has a change, and they have 83 cases. Bemidji, 96, Billings, 119, Great Plains, 158. Navajo Nation has 359 cases, which is a remarkable decrease. Oklahoma City, 990, Phoenix, 536, Portland, 197. So what you see in highlighted yellow are the areas in the country that have shown an upsurge in the number of cases. The areas that are not highlighted either show a flattening or a decrease in the numbers. So as you go through week to week to week, you can see that not all areas and not all places are the same. Some places have gone up, some have gone down, back and forth. And so it's good to see that over time you can track these numbers. So as we go to the right, the percent change, the average is 9.75% change from the week prior. And then we obviously see the numbers of change with the greatest impact. So Alaska has a percent change that's increased. Bemidji area, Billings, California, Oklahoma City, and Portland are the more significant ones. And as we go to the far right, we can just see the trend. So all the U's is an upward trend, a D is a downward trend, and the F is a flattening or plateau. So we can see that the Bemidji area, which I'll be talking to shortly here, is a upward trend, as well as the Billings area and the Great Plains. So not all areas are the same, and there are times when they do flip-flop, but I do want to highlight that the Navajo Nation, so you can trend that number 359 this week, 619 last week, 599, and so forth. You can see that there was a progression of cases that have gone up and up and up, and then a sudden dramatic drop. And so that is pretty significant. And so it's important to see that. So there's a question that's being asked, are positive, percent positives based on population or just percentages based on those positive in comparison to those tested? So the percent positive is the number of positive cases over based on the number tested for that area. So that is so let's say Alaska, 0.8% positive rate of testing for that population. So pretty small number, but it gives you the percent positive of tests being conducted in a population. Next slide. So I'm going to get into a little more specifics into the areas such as Bemidji. Again, the Indian Health Service reports out on federal, tribal, urban programs, 660 cases, 34 health facilities, and a population area of 186,000 natives. So that's what IHS is reporting out. When we start looking more specifically at the health department websites of each state, we get different numbers. And so Wisconsin, 504, Minnesota, 455, Michigan, 322, Illinois, 241. And as you add that up, that's 1,522. So you can see I had mentioned that 70% of the native population reside off the reservation. And so as being off the reservation, living more in an urban setting, there are going to be individuals that utilize health systems outside of the Indian Health Service. So IHS reports 660. All of the state websites report out 1,522. Same thing when we look at the Great Plains. IHS reports out 1,541, but as we go down each state, as we add it up, 2,097, a stark difference. Now, North Dakota is the only state that actually does not report out the number of native cases. Actually, they don't report any demographics of racial or ethnic disparities. So, that's certainly a difference. So I suspect the numbers are going to be much greater in the Great Plains area than actually is being reported out. So in Billings, 752 cases. Montana and Wyoming's health department website show a total of 807 cases. So as we look through each area based on the health department's website, let's say Wisconsin, 1,522. That's 144 new cases from the week prior. That's a 10.4% increase from last week. When we get to the Great Plains, only 97 new cases that the state websites are reporting, only a 4.9% increase from the week prior. Pretty good. In Billings, there's 121 new cases and a 17.6% increase. And so you can see that, it's one thing to look at the IHS, the federal tribal urban programs, and the numbers there, and kind of giving a sense of what the increases have been. But when you start looking at the broader and more, maybe a more robust system in terms of demographic of racial and ethnic cases, you get a little different picture and a much different percent change over time. Next slide. So this was something I took from the Wyoming Health Department, and it really breaks out the symptoms of coronavirus. Now we hear about fever, cough, and shortness of breath. as being the leading causes or symptoms of coronavirus. But as you go through the list, it's not just fever, cough, or shortness of breath. There's headache, muscle aches, runny nose, fatigue, sore throat, chills, loss of smell, loss of taste, nausea, vomiting, GI problems, diarrhea, or even some abdominal discomfort. And so you can see the symptomatology of coronavirus can be very diverse. So there's not just one symptom that can earmark you to have or be symptomatic of the virus. And so I thought this was important to list out because only half of Wyoming's cases actually had a cough. And as you go down, and even fever, 45% of cases. And then when you get to shortness of breath, a little over 26, maybe 26% of cases actually you are short of breath. So you don't have to have all three of those, the more typical. You can have a variety of symptoms that could very well be related to coronavirus. So next slide. So as we look throughout the region, I just wanted to highlight, looking at Wisconsin, 51,000, 13.8% increase from the week prior. We've had 6,200 cases since last week. Since last week, I reported out. So that's fairly significant. In Michigan, 80,000, 6.5% increase, 4,900 cases. Indiana, 5,600 cases, almost a 10% increase from the week prior. In Illinois, 8,600, 5.5%. And in Minnesota, almost 5,000 with a 10.4%. So as you look throughout each one of these states, you can see that the percent increases is going up, consistently going up across the board in every state. And so, this is not just an impact of Wisconsin, is the impact of the entire area. So let's get into the tribes of Michigan. And so I use counties as a proxy because not every tribe is publicly listing out the number of cases. So this is a kind of an indirect way of kind of highlighting the activity that's going on with respect to each tribe. And as we go down, we can see that probably the most significant areas would be Hannahville as being an upward trend. Everyone else has there are cases, but they're either plateaued or they're actually decreasing. So with respect to the counties and the tribes that reside in those counties, you can see that the numbers are not that dramatic. And so when we look at the states reporting out of native cases, 322, that's only 17 new cases from the week prior, a 5.6% increase from the week prior. And so when we look at overall the state of Michigan, the tribes seem to be faring well. And so that's certainly a good sign for the tribes in Michigan. If we go to the next state of Minnesota, we have a little bit of a different picture. So for the most part, we can see, Red Lake, White Earth, Leech Lake, Fond du Lac, their numbers are decreasing. The trend is decreasing. The number of cases in their counties have been decreasing. So that is a good indication. When we get towards, more like Minneapolis or Shakopee and Scott County, higher population there. That's, certainly a higher population other than the tribe. So that county is actually on the upward swing. And then we have Mill Lake and Upper Sioux and their respective counties. Mill Lake has really taken a significant jump in the number of cases, and so a lot of activity going on in Mill Lake, as well as a lot of new cases in Upper Sioux. So the Minnesota Department of their Public Health, 455 cases. That's 50 new cases from the week prior. 12.3% increase. Now, that's actually down from the week prior of 17.4, but collectively, when we look at these past 2 weeks, 110 new cases, and that's pretty significant given that is actually 25% of all cases have come out of the last 2 weeks. And so it's just important to put everything in context. And when we look at these numbers, you can just say, well, a number is a number, but if you look at it in a little more specifically, you can see that the changes, at least in the state of Minnesota, 25% of all new cases have basically come out of the last 2 weeks, and that's pretty significant. So let's get to the state of Wisconsin, and we'll go through the tribes, the 11 tribes of Wisconsin. So as we go through it, Wisconsin has a much different picture compared to Michigan and Minnesota. Nearly every tribe has seen a significant increase. So Stockbridge has shown, Menominee, Oneida, the Coudray, Winnebago, St. Croix, all have shown dramatic increases in their respective counties. Now, the state has reported out 504 Native American cases. That is 66 new cases from the week prior, 15% increase. But again, if you look at the last 2 weeks, we're looking at 143 new cases, and that's a pretty significant amount given that all the weeks prior, the numbers have been much lower, more in the teens, low 20s, and then all of a sudden we have a week of 51, 77, 66. So a pretty dramatic increase for the state of Wisconsin and the tribes, as well as the population of natives in Wisconsin. So, a lot of dynamic changes. Some of the tribes have made announcements over this last several days and even into this week. So we know that the Menominee tribal offices had to limit their opening due to the increase in influx of new cases over the past week. We know that the Oneida Nation has mandated a mask for reservation in all businesses. So, they've got more than 70 cases, tribal members, Oneida. So again, a lot of changes have been occurring, a lot more numbers. The number of cases is certainly more dramatic as we look throughout the state. So, and the last portion of this is Illinois. I bring this in because there is a urban health center, urban Indian health center in Chicago. There are no federally recognized tribes, but we do have family relatives that do reside in the state of Illinois, and they are part of the Bemidji area. So 241 cases, 11 new cases from the week prior. So again, every state has its own distribution of racial and ethnic cases, and natives in Illinois are no exception. Next case. I just wanted to quickly bring this to your attention. So again, just highlighting the numbers and the percent change and the rates. And so you can see at the bottom that whole string of numbers. You can see from week to week to week to week, the number of cases, new cases the increases have not been very dramatic. It has only been in the last 3 weeks where the numbers have dramatically gone up. And so just like with the state, tribes and natives within Wisconsin are not immune to the coronavirus. So I will say this, that the number of fatalities has remained stable at 10. This is probably going on week 7 now. I think perhaps even week 8, where there has been no new deaths in the native population due to coronavirus. So again, mixed bag of good and bad news. Next. this was just another highlighted. I want to make sure that people understand. So the rate of increase of new cases, the most dramatic obviously is the 20 to 29-year-olds. From last week to this week, there's been 1,500 new cases in the 20-year-olds, and then 800 in the 10 to 19s, and 1,000 in the 30 and 800 in the 40-year-old range, and then 800 in the 50. So, no age group is immune. It's just that the rate of new infections are dramatically higher in that 20-year-old bracket. So that's going to be something to watch as time goes by, and also that younger 10 to 19 will also need to be continued to be followed as well. As we go through the average, the 7-day average, next slide. Then, oh, I'm sorry. Yeah. So this is, I just wanted to highlight. So I've been showing this for the last several presentations. And as you can see, Minnesota, our age group, that 20-year-old Minnesota is very similar to us. Michigan and Illinois, they, in the beginning of coronavirus, they were much more dramatic in the 60 and 70-year-old age group, but as time goes by, that is shifting to the left and shifting more into that younger age groups. So Illinois is following that. They are starting to move more and more cases into that younger, as well as Michigan, and Indiana is following suit. So for the most part, nearly every state has a pretty dramatic graph, just like this, the bar graphs, where a huge portion of cases are in that younger age group. Next slide. So just looking at the 7-day average, and I had mentioned May 30th as being that high point of that original peak, and then we went on a downward trend, and then about June 14th it started changing, and it just continues to go up and up and up. And over the last 7 to 10 days, we've had some pretty remarkable record-breaking numbers in the thousands, and even right before this presentation, I checked the numbers. We had 1,059 cases in Wisconsin, and our 7-day average has now gone up a little bit more. We are currently sitting at 886, but after today, it's going to probably go up maybe another 10 points. So just never stops. So next slide. So bringing it back to Milwaukee, 18,827 cases, 381 fatalities. As you look at the center map of Milwaukee County, you can see that that distribution seems to be pretty even between north of the highway and south. There are some areas that maybe show a little more dramatic in terms of numbers, but the numbers aren't those circles, that's more like maybe 20, 25 active cases. It's not like a tremendous amount. But as you just generally look at the entire city, pretty evenly distributed throughout. And so just important to realize it's just not one area, it's everywhere. Looking at the bar graph on the left-hand side, again, that age group distribution, the younger 20-year-olds, 4.4 thousand, the 10 to 19, 1.8 thousand. So again, as the state, just along with the state, Milwaukee has a very similar profile. And as we look to the right, the number of fatalities by age group, obviously the older age group has a much higher portion of cases versus a younger population. So those are the highlights to take notice here in Milwaukee. Next slide. So looking at Milwaukee and the demographics of racial ethnic breakouts, Hispanics, Black, white, obviously more cases on the far left. And as we go to the right, you see the number 76. So that's 76 cases overall that have been confirmed of coronavirus here in Milwaukee. Last week it was 58. The week prior was 50. So again, the overall number is low compared to everyone else. But again, that is new cases ongoing this week. And it's important to recognize, because that's for natives that reside in Milwaukee, this certainly could be pertaining to you or even your family. So next slide. And this is something I introduced several weeks ago, and this is really about the vaccines. So I'll just quickly go through the highlights. So we have Moderna, AstraZeneca partnered with, Moderna has its own vaccine development, and they are just starting their phase 3 human safety trials, and they've already taken part in their identifying 30,000 individuals. They've already have them lined up. They just need to get these test centers up and going. AstraZeneca partnered with the University of Oxford out of the United Kingdom, as well as with the U.S. Department of Health and Human Services. Big money contracts have gone out to develop 300 million not cases, but doses. So big techs definitely involved. Next slide. On the right-hand side, we have Pfizer. Pfizer is also a biotech farm industry, and they have came out with some pretty positive news on their vaccine front and development, and they are they're very high on their vaccine and its development, and they've started their phase 3 trials as well, and hopefully each one of these companies will have information for us. What is this now? July 30th. AstraZeneca and Pfizer, they've started their human trials, their phase 3. Expect information to come out. I'm thinking in about 2 weeks, if not the beginning of the 3rd week from now. We will know what the development and where we stand with those vaccines. So certainly stay tuned for that, because that's going to be important information to come out. Next slide. Another concept I brought up last week, and this was about herd immunity, and talking about the indirect protection of the population from the virus. And so some of the highlights from that discussion was to determine what the contagiousness or the R naught of a particular disease, and in this case, if we're talking about coronavirus, what's the R naught? And if you go to the next slide, we're talking about the equation. So this is really looking at that critical value of a population to render an infection I guess the render its ability to limit or cease the epidemic within that population. The equation is 1 minus 1 over R naught. So as we go through the next slide, I presented, diseases such as measles, pertussis, diphtheria, smallpox, polio, mumps, and then we talk about, where COVID-19 is, SARS, and the flu. So disease, transmission, airborne, and the contagiousness. So the higher the R naught, the higher the herd immunity threshold needs to be in a population to render that virus ineffective. So measles, very contagious, more contagious than anything that we know, 12 to 18. Well, for us, the population to render itself immune or render the virus ineffective to spread, 92 to 95% of the population either has to have had it or have a vaccine, which we do. We have vaccines for everything on this list, with the exception of COVID, SARS, and Ebola. So the herd immunity threshold for COVID-19 are not as 2 to 6, relatively on the lower side comparative to the measles, 50% on the low end to as high as 83% of the population either has had to have had it or the population needs to be vaccinated up to at least 50. Anywhere between 50 and 83% of the population needs to be vaccinated. So I mentioned we were approaching 4.5 million cases. The US population is 325 million, 4.5 million cases. For us to get to 50%, we need about 162.5 million cases, either through getting infected or vaccinated. So we're nowhere close to 162, even if we take in all the asymptomatic, which people are saying maybe up to 10 times as much, 10 times as cases right now. So even if we add that, we're talking maybe 45 million now, 45 million. We're still 120-ish short. It's a lot of people to get coronavirus, and I think that's why there's such high hopes of these biotech companies to come out with a vaccine to get us over that threshold. And that'll be huge. That'll be particularly huge if we were able to have that vaccine developed and be able to distribute that throughout the United States. So this new concept I'm going to be introducing revolves around a lot of discussion. Everyone who has kids, school-age kids, to administrators of schools, boards, policymakers, families. I mean, it's just that important to have this discussion because we're almost done with July and we're already talking August and Labor Day, and we're going to be talking about going back to school. So I wanted to bring this up because last week the CDC came out with a paper. It was titled "The Importance of Reopening America's Schools This Fall." It was published July 23rd. And this may have gotten lost in its importance when it came out because, like I mentioned, it really talks about a lot of the harms of having schools closed. We're talking about the social, emotional, behavioral health, economic, as well as the well-being, academic achievement of children, both short and long term. School has a pretty significant impact, not just for our kids, but also for families, jobs, incomes, bills, and so forth. We've all had our lives upturned as a result of the coronavirus, but the CDC, in publishing this paper, was really trying to drill down on what the facts, what could actually impact not just individuals as family units, but also individuals, particularly the school age kids. Now, understandably, parents are concerned not only for the safety of their children, but also, the school as a whole and what the school offers to all of our children. Now, the CDC came out with this paper really to bring home the lack of in-person educational options. And we know that this disproportionately affects and harms people of low income and minority children and those living with disabilities. Huge, huge issues. And never more truer for our Native population. Big impact, big impact. So let me go through some of the highlights of this paper. Now, the best available evidence indicates if children become infected, they are less likely to suffer severe symptoms. We know this, we follow this, even within the state of Wisconsin. So we know more cases of 20-year-olds, 10 to 19-year-olds, and even the less than 10-year-olds age groups. There are cases, there are fewer cases, especially in the teens and young kids, younger. It's even rarer for these individuals to become hospitalized. We just don't see it. And even of the kids that do get hospitalized, even fewer actually are admitted to the ICU. So, and then as a outcome of having virus, even the number of fatalities is even remarkably lower than every other age group out there. So we know younger people and kids do get infected. We do know that they require fewer hospitalizations, even fewer ICU, and even fewer deaths. So as the CDC has pointed out, children appear to be at lower risk for contracting COVID-19. So I'm talking about the probably the K through 10 age group are definitely at lower risk compared to adults. Now, as the CDC has reported out, the United States reported that children and adolescents under the age of 18 account for under 7% of all cases and less than 0.1% of all COVID-related deaths. That is really, really low. Now, as a comparison, flu related deaths, while rare in children, they have accounted overall through the United States. And so when we start looking at data points from the flu from 2004 to 2018, the flu-related deaths in children range from 37 to 187. And I'm not sure if people remember the H1N1 epidemic. This was in 2009 to 2010. There was reported 358 pediatric deaths during that period, during that time. So we know flu, seasonal flu, certainly can impact children and flu-related deaths. H1N1 had that same impact as well, but at a much higher rate than the flu. And then what CDC also wanted to point out was that the number to date related to COVID, the deaths related to COVID are far less than they have been in the last 5 flu seasons. And as of right now, it's only 64. So the last 5 flu seasons to date, COVID-19 has resulted in fewer deaths. Now, the reason why I bring this up is that, relatively speaking, we don't hear about comparisons. We just hear about COVID. We just hear about the numbers, the impact, the outcomes. But when we start looking at comparisons to H1N1 and the flu, were, there were instances where the flu in specific districts, school districts, resulted in closures. Not a lot, but we don't close schools because of flu. Even if there are cases within a community, we know it happens every year, and we don't result in closure. Just like the H1N1, we didn't have a dramatic closure like we did with COVID-19, where it has such a nationwide impact. And when we're talking about symptoms, we're talking about fatalities related to COVID-19. We have a much different discussion about this right now than we did when we had the flu, where the numbers were higher, or even the H1N1 when the pediatric fatalities were much higher. So it's an important point, because no one talks about COVID-19 in terms of flu or the swine flu, and so that's important. And I just want to make that a point, because it is something to think about as a family, for your children, as to the potential of impact. Next slide. So just as a result of this paper, and the CDC has looked at everything, not just within the United States, but internationally as well. So the studies that have come out suggest that COVID-19 transmission among children in schools is low. That's what the CDC has come out as a statement. International studies, and we're talking about Sweden, Denmark, France, Germany, have come out with their own studies, because they didn't close schools. International studies have assessed how readily COVID-19 spreads in schools. They also have revealed that low rates of transmission, when community transmission is low, have been low. Just a point to keep in mind. Now, based on the current data, the rate of infection among younger school children and from students to teachers, I'll read that again. Based on the current data, the rate of infection among younger children and from students to teachers has been low, especially if proper precautions are followed. So what would that be? Face coverings, face masks, hand washing, social distancing, 6 feet. There wasn't anything specific or dramatic that these schools undertook, other than the safety precautions of what the CDC came out originally in its precautions in the beginning. Transmission of children and from from students to teachers has been low if proper precautions are followed. Now, there have also been few reports of children being the primary source of COVID-19 transmission among family members. So I've observed this. This isn't, I guess, not surprising when the CDC has come out with this, but we've seen more cases of younger people contracting the virus. It doesn't necessarily mean the entire family or the entire household is going to become infected. I haven't seen that. I've seen teenagers, I've seen kids, maybe I think, was it 4 or 5 years old? Yeah, they came out positive. They had symptoms. They came out positive, but the house did not become positive. And there may be 4, maybe 6 additional people living in that same household. They did not become infected. Now that kind of is counterintuitive, because you'd almost think, well, if it's that contagious, then everyone's going to get it. And the answer is no. So even if you do have a family member within your household that does have virus, doesn't mean everyone's going to get it, as long as everyone follows the rules. Following the rules. Individuals do need to be isolated as best they can. They need to disinfect, isolate, remove themselves, separate themselves until their symptoms get better. And so just because a family member has it doesn't mean everyone in the house is going to have it. So that's important to know. So now this is consistent with data from both virus and antibody testing, suggesting that children are not the primary drivers of COVID-19 spreading in schools or in the community. So we hear about kids being super spreaders or being the ones, the drivers to drive all this infection. And basically the CDC has come out and said that is not happening. They don't see kids as being the primary drivers. That's just not happening. The numbers are not there and do not support that notion any longer. I don't know if it was based on anything scientific, but that was the general thought, is that kids would be the super spreaders, and they're not. They just flat out are not. So the best available evidence from countries that have open schools indicates that COVID-19 poses low risk to school-age children, at least in areas with low community transmission, and suggests that children are unlikely to be major drivers of the virus. So that's important. And these are important points. And this isn't me rendering my own opinion based on what the CDC, these are the CDC's words. These are not mine. I may be kind of helping in the translation, but the words are from the CDC. These are not my words. And so it's important as family, as parents, when we consider school, you have to have all the information and be able to formulate your own opinion based on the information that's out there. And this is the information that's out there. And I think CDC has summarized this really well. And so let me talk about one more slide. And this is from an education standpoint. So we know disparities occur in outcomes as a result of school closures. So in particular with low income and minority students and students with disabilities. And so I say this because as this town hall is based on principally around a Native and Native discussion, we know that our families, our tribes, suffer from both of these, from the impact. So many low-income families do not have the capacity to facilitate distance learning. So we're talking about internet access, we're talking about computers, laptops, notebooks. You know, from families of low income, having to struggle even right now, don't have those financial means to help their students do any type of virtual or distant learning. It's just money's not there. And so many families rely on school-based services to help support their children's academic success. Now, CDC points out that a research study out of Brown and Harvard assessed how 800,000 students used Zearn, which is an online math program, both before and after schools closed in March of 2020. The data showed that through late April, student progress in math decreased by about half, by 50%, with the negative impact more pronounced in low income zip codes. Okay, so we're talking about maybe urban centers, minority-based urban centers. We're also talking about zip codes on reservations. Another point, persistent academic gaps that already existed before COVID, such as disparities across income levels and races, can worsen and cause serious, hard to repair damage to children's educational outcomes. So putting that in context to the Native population, where we know that there are lower lower degrees of success, not only graduation, high school graduation, or even going on to college, but we're talking about some fundamental basic building blocks of education that have already impact people of color, particularly natives. So looking forward, looking from here on out in terms of school and its closures and how we go about learning and how do we make this successful in spite of COVID for our kids, I think it's important that you have the information to know that there's going to be impact. And it's not going to be short term, it's going to be long term, because we're talking about spring to this year, to now, to going into fall, and what is, next spring session look like? I mean, could we be losing another, 4 months of schooling to Christmas, and then after Christmas, we could be losing a whole year, and we already know what the impact is. That we all know it's going to make it harder. It's going to make it more difficult. Remote learning, it just makes the information so much harder to absorb for students, especially of low income, minority, and even students with disability. So again, I wanted to bring this up, and I know people may not necessarily agree with everything I've just said, but it's not just me saying it or giving you my own opinion. It's what the CDC is saying. And so I'm taking and I'm extrapolating and translating that and how it relates to the Native population. So we just know the disparities, not only in income, but also in educational and our success in primary and secondary schools. We're just going to get impacted much harder than the general population. I don't exactly have a number or a study to highlight this, but I think we all know in our guts that it's going to happen, and it's going to hurt our students. It's going to hurt our families, and their ability to be successful may be hampered because of this. So I just wanted to throw that out there and make sure that people have this information when they start having these discussions, because it's coming close. If they're not already, or being on school boards or voicing your own opinions or filling out a survey, that you have the information that helps support what you feel should happen for your family and your kids. So let's go through. Yes, so high risk for severe illness related to COVID. Age group, 65 and older, nursing home, long-term care facilities. High risk conditions, particularly individuals with cardiovascular disease, pulmonary disease such as COPD, moderate to severe uncontrolled asthma, immunocompromised individuals, people with autoimmune disease or cancer, and people who are going under chemotherapy for cancer-related illnesses. We know BMIs, high BMIs do put people at risk, and in particular, people with diabetes, renal failure, liver disease are particularly at higher risk. Next slide. So GLIC from the outset has put in a fair amount of outreach activities to help support the community through this. And so we put out Safer at Home kits, which are disinfectants, soap. We're looking at adding masks as well as hand sanitizer to these kits. So if you feel the need to have to help protect your family even more, please feel free to call us. We'd be more than happy to provide you with such a kit. We also have programs, Circles of Strength to help support and guide people through either domestic or sexual abuse. We also have a youth empowerment program to help support our kids during the summer, especially when everything seems to be shut down. They really don't have the ability to go anywhere. So our youth empowerment program helps kids at least virtually, as well as ideas they can do at home. We also provide prevention of diabetes, high blood pressure, and cholesterol discussions about prevention and education. So please feel free to partake in those activities as well. I wanted to bring up, we have a community health fair. We have a community health fair every year. This is in support of our clients and our community as a whole. We do offer a lot of prevention, a lot of education materials, not just from our organization, but we partner with multiple different organizations, a lot of 501c3 or nonprofits that come and will be offering information. Now, what will be different this year is that this is going to be a drive-through. So I'm not saying it's going to be like going through one of the fast food restaurants. You just put in your order and you pick it up, kind of, but you don't have to pay for it. It's all free. So there's no reservations. There's no time. If you come, we will have a mask for you. Everyone at the community health fair will be wearing a mask, and will be offering contact-free screenings, diabetes, and blood pressure. So August 6th from 2 to 4, it will be a drive-through. We'll be handing out a lot of information to help support people as they go through the rest of the summer into the fall. We'll also be offering those safer at home kits as with hand sanitizer and face masks for not just you, but as a packet for the family to use, because you will be needing them as we move forward. So please join us. I hope to see people at our community health fair. That's next week, August 6th, next Thursday, actually. So we have the ability to test. We have full capacity to not only test individuals with the Abbott ID Analyzer Now, which takes 5 minutes. If you truly do have the virus, it will tell us within 5 minutes, either if you're positive. It will take up to 15 minutes, sometimes 20 minutes to show a negative. So we have that capability, as well as the confirmation test, which is the more traditional one that everyone knows about. So if you have a fever, you have headache, sore throat, a cough, body aches, fatigue, nausea, vomiting, loss of smell, loss of taste, GI symptoms, nausea, vomiting, diarrhea. If you have any one of these symptoms that are unexplained or can't be related to anything specific, please call us, 414-383-9526. We will assess you and determine a date and a time for you to get tested. So just a quick reminder as to items you could do at home or things you can do to help protect yourself. Wash your hands, 20 seconds. If you don't have soap, or if you have hand sanitizer, please use that. 60% ethyl alcohol. Don't use the methanol. I'm sure people have heard about methanol, that it is toxic and is not recommended for use. Wear a mask and social distance, limit large gatherings. So with that, I will turn this over to you, Jeremiah and Mark. I'd be happy to answer any questions.
Dr. Ignace, good to see you, and thank you for the updates around our community. Behind me, I have teachers. One teacher, Rona Wolf from Milwaukee Jewish Day School. They're on my left, pre-K, and from the Indian Community School.
All right.
She's also there. And we have a guest as well, very big supporting team out there, socially distanced, wearing masks.
There you go.
Not breathing on my bald spot, which is awesome. But all fun aside, people also have questions for teachers as well. And they have questions because we have schools out there some are saying, hey, you know what, let's just shut it all down, Milwaukee public school system. Other schools are saying, well, let's do something that's blended. You know, they'll come for a part of the day and we'll take shifts with the students and that kind of thing. Schools seem to treat this like a either or proposition. Either we're closed and online, or we'll do blended and we can be everything to everybody. No one's talking about, hey, you know, if we need socialization for our young people, let's have smaller play groups, that kind of stuff. My point in all of this is there's lots of different answers that are out there. And just my question to you right now, and then we can go back to the teachers if they have questions or statements about what they're experiencing, is just there's education topics and education champions, and there's health topics and health champions. From a health perspective, what is your look after looking at all of these studies and all this information, talking to our Native parents throughout the city of Milwaukee? What is it that kind of is your view on should we have our schools open or shouldn't we?
That's a question, right? Not a statement. No, I get it. And believe me, that's why I wanted to bring it up, because at least to open this up, because it's going to be a difficult decision. So if you're asking me whether or not schools should be open, you know, it's interesting because I talked to other healthcare providers. I talked to pediatricians. We have one on staff at Glick. And so I presented this same topic Monday, this past Monday, to my staff. And the pediatrician that works with us came up out of nowhere. I was in this big room and she came out of nowhere, and she looked like she had a pretty stern face, and I was like, oh gosh, maybe I'm in trouble for saying the wrong thing. But she says, no, I agree with you. I think school should be open. Kids need to be in school, which was basically her bottom line. And she was pretty adamant about it. And I was a little taken back because I wasn't sure what her reaction was going to be. But hers was a straight up, the kids absolutely, without a doubt, have to get back in school. I take that information from a pediatrician, obviously, who sees a lot more younger people than I do. I see adults. She sees kids and adolescents. So she understands the impact, and I think she understands the impact, how this could be on not only the social, the mental and emotional aspects of kids, and she sees it as being detrimental. So after reading the CDC report, my sense is to open the schools. And I think there is a way to do this where I believe you can minimize. Now, there will be cases, without a doubt. I'm sure this will happen. Kids and adolescents will get the virus. But what we know, the transmissions are low amongst kids versus even low to students to kids. And I think probably the most important aspect would be how do we direct safety to the staff, our teachers, our aides, our administrators. I think that's going to be the highest priority focus. Now, for school-based individuals, adults who will be in school, you know, the analogy that I could take would be as a frontline worker at our health center. So all face-to-face encounters at our health center require individuals to wear a mask. And we wear a mask everywhere. We wear masks when we even talk to each other, and we're wearing masks. Our frontline people who are testing wear masks all the time. And since March 12th, when we implemented this protocol at our facility, we haven't had a transmission. We've had employees become positive, but when we do the tracking of these individuals, um, there is a very good justification of how they may have gotten the virus, and it wasn't because of direct contact with patients that we've been seeing, but from the outside. So I think it can be done. I think it can be done safely, but we're talking about huge undertakings that normally we wouldn't have even considered, and this would be very dedicated teams for disinfecting high traffic areas. Not just having hand soap or bars of soap, we're also talking about hand sanitizer. We're not talking about little containers, we're talking about like big containers, of hand sanitizer and masks. And if we want to talk about masks, there are certain levels of masks that are better, and there are ones that are you might as well wear nothing. So there are ways, and I think just being hyper vigilant about your surroundings, and minding hands and contact to surfaces, doorknobs, countertops, everything. There's ways to help protect yourself as an individual, but also protect yourself even when you're amongst other people. And I'm talking, teachers protecting themselves amongst kids. There is that way of a level of protection. I think what may also come as a result are the kids may have to wear some level of covering. Now, I'm not talking about everyone has to wear a surgical mask, but I think a covering is better than nothing. And if you want a higher level of safety, so kids have some type of face covering, and teachers and administrators, aides, and employee staff may have to be looking at a surgical mask. So we know a surgical mask has a higher level of protection than a face covering does. But put those both in combination in a setting where you are distancing, where you are hand sanitizing, and you are disinfecting, I think can give you a very high level of comfort that your environment will be safe.
I want to follow up on that point. We have a question from a first grade teacher who's fortunate enough to have a sink in their class. And it just has cold water. And her kind of question is it better to wash with cold water and soap, or I think we've gone to this question, hand sanitizer. You've been a great fan and certainly seen studies that soap and water is best. Mm-hmm. But with teachers that maybe have warm or hot water, is there anything around that? Or is it just soap and water? Let's do that.
Yeah, so I have not heard if warm is better than cold. I think the fact that you have a faucet with running water and be able to use soap, it's to render the virus inactive or to help destroy the envelope of the virus. It is the soap itself that does that. It's, regardless if the water is warm or cold. It's the soap and its inability to disrupt the envelope of the virus. I'm sure we've all seen pictures of the spiky coronavirus. Basically, that acts kind of several ways. One is an attachment, but also as a protectant of itself. And so you want to destroy that outer barrier of the virus. It is the soap that does that. It's the phospholipid layer. It's a little scientific, but again, it's the soap that disrupts that and will render it inactive, regardless if the water is warm or cold.
So following this train of thought, just knowing that you're a baseball fan, certainly familiar with the Miami Marlins, $980 million estimated worth ball club that has a 200-page manual on how to avoid COVID-19. Just this past week, they've come up with 18 adult individuals testing positive for COVID-19. So I think administrators in schools, teachers are concerned about that adult to adult transmission. I mean, what to do. We kind of went through that just a bit. But just kind of moving forward, because we can have those sorts of debates, there are new CDC guidelines, and this goes into the next question, is how do we compare those? The CDC at once came out with health guidelines that seemed to be health related. Then it seemed things got politicized in the country around healthcare, and now we're looking at new CDC guidelines. Any insights into your thoughts about these new CDC guidelines, or what are your thoughts?
I'm not sure which ones you're particularly referencing, but kind of universally that it really hasn't changed that much. So other than kind of having that more of a requirement to wear a mask or a covering, they talk about face coverings, but from a health-related perspective, I view coverings more like masks, like a surgical mask or an N95 mask. That's the kind of level of protection. Obviously, hand washing, hand sanitizer, and disinfecting, social distancing. You know, it's that level of unless something has dramatically deviated from that, I'm not particularly sure what the new ones you're referencing. Oh, and just get back to the prior question. I see that whether it's warm or cold or soap, or should we use hand sanitizer? If you have soap is just a little bit better than hand sanitizer, but if you have both, I would use both.
What I have is just a few more minutes with our teachers here. If there's anybody that has questions for the teachers, please let me know, because they're here and they're getting trained out there. They're in frontline positions and they're dealing with the really tiny folks. One of the things about COVID-19 that is really out there right now is why the uptick now? I understand we're coming off of July 4th and we're within that window where the COVID is maturing, and of course, in the Native community, we've had a run of ceremonies, many of them canceled, but some of them have happened. And then certainly the informal powwows that are happening in Wisconsin. I mean, that's where they're not sanctioned by tribes. They're not sanctioned by anybody really. It's just folks kind of showing up because they miss dancing. It's part of what they feel and are rightfully so. This is a part of their mental health. Is there any insights into activities like ceremonies, like dancing around the United States that you could shed some light on? Are these things contributing to the spread of COVID-19 in Indian country?
You know, it's hard to say. You know, I haven't observed or know the dynamics of the setting, and the only way I'd really know is if I was actually to observe what would occur over a period of time. But if they are wearing masks, and there is a level of separation, it is outdoors, and you know, other than that, they are practicing, you know, either washing their hands or using hand sanitizer and using a face covering. You know, I would think the risk of transmission would be low. The only thing that would deviate from that would be is if people were not kind of not following the rules, or interacting, you know, unmasked or uncovered, and, you know, being in direct contact with others, or even in singing and drumming, that even though they may be 6 feet away, they're still projecting not only their voice, but also how they I guess aerosolize their voices as they are singing. In a small group around a drum, that certainly could be, I would say, risky. Now, if they could do it with some type of face covering, that would help. But again, face coverings, either cotton or polyester, aren't going to stop everything from coming out. It's if they have corona and they are projecting, it will still go through the mask, not at a, it will still come out, not like if they were not, but it will certainly reduce it, but not eliminate it.
Dr. Ignace, just a couple more questions from our side is a lot of our parents and teachers and administration, they're study after study. There are folks that are now populating social media with very questionable information. Just recently, I believe there was a video of doctors in lab coats, so to speak, talking about COVID-19 wasn't what folks were thinking about, and giving folks different information than what the CDC was saying. So, and I get this a lot too. The question comes down to, who do I trust? And where do I get my information from? Because the information is just coming at people daily, as I'm sure it is to you. What's your best recommendation from a medical perspective of when people are hearing information? What is it that they should be looking for or looking into to check out the veracity or the truth of what is being said?
Sure. So one of the things that I, as one of my sources that I would fall back on, are medical journals and the studies that are conducted and the biostatistics that come out and the reports, probability, all these things. That's one part of information. If you want to talk about scientific based, that's what I use. Also, the associations, professional healthcare associations. So the Academy of American Pediatrics, or that would be a source to use. I do rely on information that comes out of the CDC. So so information that comes out of the CDC, either them or NIH, National Institute of Health, for them to take a position or provide guidelines or recommendations doesn't come out of thin air. I mean, this is really think tanks put together, not just thinking about health policy, but also how do you match what we're seeing from a science base, and how do we match science base with a health policy that assures a level of not only prevention but also education. So CDC, I think, I feel is a trustworthy, reliable source of information. So for them to come out with this paper last week on July 23rd, that has to be vetted and integrated with multiple, and the footnotes that came with the paper certainly support their positions. So they may be giving more that executive summary level paper position, but it really is based on the hard facts and the science-based information. So it's not something they've created. These are, or even reproduced. This is information that's not just here in the United States, but internationally, in the information, the studies that they've put this together in a very sound approach. So I believe the CDC to be reliable in the information that they are able to provide to be trustworthy.
It's really helpful for a lot of people. Thank you for that. We're going to move to our last question here, and that is, and this one's going to be for the teachers that are behind me. And please remember, these are teachers that are K-4 folks from two different schools. And Dr. Ignace, you might want to weigh in after they do. And this one is directed to the teachers, and it is for everyone that is watching. For the teachers, what is most crucial for kids, academic instruction or social emotional learning? And if kids will not return to school, how can parents, guardians make sure social emotional learning is addressed? So I'm going to turn this over to our two teachers behind me, Rona Wolf and Lindsay Davis. If you might kind of come forward to this couch here, and I'll get out of the way, and you can take turns at looking at this one. Dr. Ignace, please hang in there, and maybe you can do the add-ons. Thank you.
Hi, I'm Lindsay Davis. I teach at Indian Community School. And, you know, for me, it's been really important to try to connect with my students no matter what. I think that social emotionally, especially for our kids, is probably one of the largest academic areas actually for us. And I think that what's important for parents to know, though, is that even if you're not in a school, it's not hard to get those things and those resources for students. And the most important thing is to have a positive attitude no matter which way the school goes. I think that parents have a very, they're their first teacher, right? They're their students' first teacher. So it's extremely important for parents to know that even no matter which way it goes, this school is going to be here for you, and we're going to be providing resources for your family. We're going to be providing resources for your students. You know, it's hard to think about not going back with my kids. However, it's also hard to think about how already with the large classroom sizes in most schools, I mean, luckily I'm fortunate enough not to have that problem, but I do worry about my public schools and how those teachers are going to get around a lot of the obstacles that I think that I'm fortunate not to have to necessarily burden. I think that it's important for families to know that even if your kids aren't necessarily socializing in person, that there are tons of things online. I know Miss Rona does a social justice story time once a week. There's tons of different, you know, play groups that they do virtually. I know that in my classroom this year, we were playing things like hide and go seek out of the computer. We were, you know, doing scavenger hunts within our houses. And so things like that don't necessarily mean that we have to be together at the park, but we can still socialize through those things.
Yeah, I couldn't agree more, Lindsay. I'm Rona Wolf. I teach at the Jewish Day School in Milwaukee. I couldn't agree more. I mean, I think if you ask any kindergarten teacher, we want to be with our kids. We want this new school year, and we want to hug and to hold. And the most important thing that we do during the day is to teach social emotional learning for our kids. So if it's what we want to be with our kids, but we also understand the struggle of keeping everybody, including ourselves, safe. I think that Lindsay said it right. It's all about making connections. I think that teachers and families need to work hard to connect with each other and to stay in each other's lives, to build those relationships, even if it's going to be virtually. I think that that's a really important thing to start with. I think that Lindsay and I would agree that without those connections and without those relationships, then really no true learning is going to take place. So we can talk about early reading and early math, and we understand that those things are important, but if we don't have a relationship with our children and with our families, and we don't have the social emotional learning to begin with, then there's nothing else that we can teach the children. We have to start there. So I think Lindsay and I are making relationships with our kids and spending a lot of time talking to our students, spending a lot of time talking about feelings, and that whatever you're feeling is okay, and that we are still a community, whether we are close to each other or far away, and that we still will be together somehow through this. And I think that that's reassuring for families and also for young children.
So, Dr. Ignace, I think what we're hearing today, both from a medical and educational side, is school is important. Our young people are important. We need to get them learning. We need to get them together and do it safely for sure. I mean, none of this I think anyone would disagree with. It's just, how do we do it? So I'm gonna leave these last few words to you, and I wanna thank Rona and Lindsay from Jewish Day School and Indian Community School respectively for being our guest today and being so patient, hanging in there all this time. They originally came here to speak at our Unity Fire happening in Milwaukee at the Ogama campus, the old Concordia campus. That fire is burning this morning at sunrise, and we have an electronic fire behind me going in case you can't make it. So I just want to say goodbye from me for now. As usual, we give you the last word, and much appreciation for all the hard work to all the teachers and parents and administrators that are listening today. Dr. Ignace, you have the final word. Thank you.
Thanks, Mark. Thanks, Jeremiah and Ms. Davis. Ms. Rona, thank you for speaking and providing that insight.
Okay, thank you guys.
Thank
Okay.
you very
All right.
much.
Okay.
I think it's important as we move forward that information that gets disseminated to folks is that we use the information that's going to be appropriate, and we get the facts, and we have those at our disposal, and to have discussion around those points of information, because it's going to be important. Without the facts and without the scientific background to help guide you through decisions, and they're going to be difficult ones, it's just going to be important that you have that with you. And so I hope, my hope is that the information that's being discussed, there's been a pretty high level discussion around vaccine, around herd immunity, around now school-based. I think as these discussions come up, it's just going to be important, more and more important for individuals to have that better understanding. And maybe you may catch a point or two from this discussion that you may not have heard about, or you needed better, maybe a better foundation in a discussion or even in a concept. So next week, Jeremiah, are you there?
Yes, I am.
So next week, next Thursday, is our community health fair. Now, typically this discussion is every Thursday at 3 o'clock. So I'm wondering if we're making a decision in real time, folks. So perhaps next week we could do a earlier discussion, maybe at noon.
I think we can make that happen.
We'll do noon next week, everybody. So it'll be just a one-time change in start time. Next Thursday, we'll start at noon Central Standard Time, and we'll go through a discussion. We'll be talking about the mental health COVID-19 has had. So, and I'll bring up any additional updated information around vaccines, herd immunity, school-based information, and even new guidelines that do come out. So until next time, stay strong, and we will see you soon enough. Take care, everyone.